in the one of the hospital in Paris belonging to the Assistance Publique in Paris, which is Henri Mondor University Hospital and linked to the University of Medicine of Créteil. Oh, big data, it's not a small issue, it's a big issue, because it means that from a lot of data, which can be clinical, biological, imaging data, anything else, you are supposed to extract marvelous information. And with mathematical models, with algorithmic, and some people think that from all this data it will be possible to get some information on things that could help to go into personalized medicine. We have a lot of partnership with US on the imaging in lymphoma. We have organized a meeting which is held every 2 years in Mondor in the south of France, which is devoted to imaging in lymphoma. And in this meeting there is generally scientific people from between 20 and 25 countries, many from United States, and we are working with in collaboration with groups involved in lymphoma research in the United States, and this meeting has established some link, and we have published some work together on this topic. The goal is to use this imaging technique as a biomarker of the effect of a treatment. That means to get an information which is not easy to obtain, because it's the only way to see the decrease of a tumor and the decrease of the metabolic activity of a tumor under the treatment, and to see, for instance, is the patients respond to the first few cycles of treatments or not. So if the patient doesn't respond, you can change treatment. So you can increase the treatment or change completely the type of treatment. And if the patient is good responder to the treatment, you can imagine that you can decrease or keep the same, or decrease the treatment if the treatment is toxic. So you can decrease the toxicity of the drugs, or you can fit the following regimen of chemotherapy to what is necessary to the treatment. So that's one way to use the imaging as a biomarker. What is important is that we can extract biomarker information that is not easy to perceive, which not visually, which cannot be perceived visually, and that we cannot even imagine. And this is, I think, the important point. It's an information get from the images, but it's not clinically known. It's not something that, for instance, if I talk about metabolic volume, I talk about metabolic volume of a tumor. It's easy to understand what I mean. It's a volume of a tumor which has a metabolic activity. It's easy to look at the tumors and try to compute the volume. If I talk about radiomics, what is it exactly? it's some parameters from the images that are extracted by a mathematical algorithm. And then it's combine different type of structure of the imaging, of the images. So the texture, but the texture I cannot say nothing clinically. This could affect the prognosis, and probably this could, if it affect prognosis, it will change with probably change therapy. If it's a sign of bad prognosis, that means that in this type of patients, we have to think about changing therapy. It would be important to select the optimal group of patients for whom the drug will be efficient, and to avoid to give the drug, a new drug, to patients for whom it will be toxic. So probably it's possible to select from a virtual population with modelizing the effect of a drug, test in a small group, the group of patients where it's optimal to perform a trial, and just select this group of patients. So it will probably decrease the number of patients needed to obtain an information of efficacy of the drugs. To be in contact with American colleagues from other fields, not lymphoma fields, but from other things, imaging colleagues, American colleagues from imaging, but who are not involved in lymphoma, who are involved in cancer, or who are involved in other fields. And knowing that by this way it's possible to change and probably to find some link. The other, and it's been working because I have presented a slide, and I discovered that one guy who is doing the research that I have presented was in the audience, and we decided to start cooperation. So it's really amazing, but it has been working because we have I've decided to send some imaging to see if it was possible to develop the research project. So it's really, it has been working.